Melanoma is a tumor of the skin occurring in the melanocytes. The melanocytes are skin cells located at the base of the epidermis. The job of the melanocytes is to synthesize and secrete melanin. Melanin provides the skin with its protection against UV radiation and also determines the color of our skin. The largest risk factor for developing melanoma is the presence of moles. Moles develop from a proliferation of melanocytes, and they are usually tan or brown, can be flushed with the skin or slightly raised. Moles are also called nevi. You may hear them referred to as that. Some other risk factors associated with developing melanoma are a family history of melanoma. People with fair skin and light eyes are at a higher risk for developing melanoma. There have also been some mutations found in melanoma tumor suppressor genes, suggesting that there may be a genetic link for melanoma. Other risk factors are exposure to UV light, whether that be natural sunlight or tanning beds. And it's also been found that sunburns, especially during childhood, can be a risk factor for developing melanoma later in life. With assessing your patient for melanoma, obviously skin assessment is going to be the number one thing to check for that. So while most moles are benign, if you find any that look suspicious, further evaluation is needed. There's a mnemonic used when doing skin assessment checking for moles. It is called the ABCDE skin assessment. The A stands for asymmetry. Normal moles are round or oval. Asymmetry is defined as the two halves of a mole not looking the same. B stands for border irregularity. This means that the edges of the mole are not uniform or defined. The edges may look scalloped or ragged. The C stands for color variation. There could be an array of colors of the mole. There could be brown, black, white, red, even blue discolorations of the lesion. The D stands for the diameter of the mole. Most benign moles are less than 6 millimeters in size. If you find one that is greater than 6 millimeters in size, that should have further evaluation. And the E stands for enlargement or elevation. If the mole is highly raised off the skin, or if the patient tells you that they've noticed that the mole is rapidly growing, then that also needs to be further assessed. Other warning signs to ask your patient about is if they've noticed any itching, burning, or bleeding with any of their moles. Performing a skin assessment on your patient should be done in natural lighting if possible. You should also have a centimeter ruler and a pen light if you need to look closely, more closely at a mole. And while you're doing your skin assessment on your patient, that's the perfect opportunity to walk them through how to perform a self-assessment on themselves. It is recommended that at home, patients have a full-size mirror and they stand in front of the mirror and slowly and carefully inspect their skin for moles or lesions. A handheld mirror is also recommended to look in the places that can be harder to see with a full-size mirror, such as the back of the neck, under the arms, under the patient's breasts, and if they have any skin folds that they need to lift up, to show them how to use the handheld mirror to look at those places, those hard-to-reach places. Also, the soles of the feet, if your patient is not physically capable of lifting their leg all the way up within a good visual range that they can check the bottom of their feet, a handheld mirror comes in handy for that as well. They should also check their scalps. If they cannot use the full-size mirror, the handheld mirror works as well. And then they should part their hair all over and just check their head as well as behind the ears for moles or any lesions as well. If you see a mole that maybe needs to be monitored closely, photographs can be taken, and then just kind of watch to make sure that it doesn't get any larger or grow any of the ABCDEs, develop any of those along the way. And then you should also educate your patient on how to protect themselves from UV radiation. You should try and discourage them from using tanning beds if you can, and then as well as if they're going to be outside in natural sun, to wear protective clothing if possible, long sleeves, pants, hats to protect their head and face, and then sunblock if they're going to be outside as well. So hopefully with preventive measures and early detection, melanoma can be prevented or caught in its early stages and treated.